Artie Morty here. I'm talking with an acquaintance of mine named Dr. Hakeem today. You are a psychotherapist. Is that appropriate? Is that right?
I'm a psychiatrist, but I'm also a psychotherapist. I'm one of those rare breeds that are both.
Right. You have such an interesting and storied career. You have been involved in gender identity and in trans therapy and trans treatment for many, many years. And you've really seen it evolve over the last couple of decades. And you've been critical of a lot of stuff that's going on. So I think it'll be really exciting to talk to you about what your role has been and what you've seen and how you've seen it change over the years. And it's really interesting being involved in this these days because there's so much controversy. The ground is shifting so rapidly that no matter what position one takes, they'll be assailed for one reason or another. What are your thoughts on that? Where do you want to jump in? Because there's so much to talk about.
Okay, so just to put it in perspective, so I'm a consultant psychiatrist, and then I specialized in forensic psychotherapy for a while. And whilst I was doing that, I started a specialist psychotherapy service to explore gender dysphoria. This was before it was ever cool. So this was in 2000. So I've been doing this for 22 years. Now I do a lot less of it, but I write a lot about it and I tweet a lot about it and I do loads of these podcasts and things like that. And I think my role was always to try and help people think about the confusion. Yeah, I'm not interested in the hormones and surgery. Loads of other people do that. I went to psychiatry to work out what was happening in people's heads. I did do a very brief 6-month post as a junior doctor in plastic surgery where I helped do the sex change operations. So I've come at it from all angles, literally.
So you're in this from the psychiatry point of view, but coincidentally, perhaps, or maybe not, before that, you actually did work as an assistant to a plastic surgeon who was doing sexual reassignment surgeries. Is that right?
Yeah. I mean, I was very junior. I was at the hold the retractor level. But you know, I can describe how it's done. I've seen it done, and but whilst we were doing it, I was thinking, what's happening in these people's heads? And what was evident was the surgeons were being the master craftsmen, and they weren't thinking about their heads because surgeons don't have to be thinking about people's heads. They'd outsourced that to the psychiatrists, and the psychiatrists are saying, well, we're just giving people what they want, and the surgeons are doing the sex change. There's a mutual denial of responsibility, really.
Yeah, I've always been saying that, like, surgeons are just, they see bodies as their craftsmen. That's their craft, is to move body parts around, so to speak, and to do that as craftily as possible. It's an art for them, and that's great, but they don't understand that the reasons people come into the operating theater are just as important. And that's not what surgeons, that's not their interest at all.
Yeah. And within psychiatry, it wasn't all psychiatrists that were doing the gender stuff. It was just a very small group. And whereas the rest of psychiatry, you know, I know a lot of psychiatrists, the rest of psychiatry were mainly saying, well, this is a bit strange. We'll let the gender people deal with that. And it was a very small group of people who were just doing gender stuff that were being the gatekeepers, really.
Yeah. You were running group therapy sessions. Is that right?
So I trained in both individual psychoanalytic psychotherapy and I trained as a group analyst. And I saw people both individually and in groups. But what I found the most useful were the groups, because if you think about the trans mind, and I've always said that there's something very autistic and very black and white about the trans mind. And, you know, the trans is necessarily binary, black and white, right or wrong, male or female. And that got replayed in the individual setting. So you found yourself in this pantomime, patient therapist, yes, you are, no, you're not, you know, man, woman. But in a group where everybody in the group has a gender dysphoria of some form, and I'll come back to that, apart from the conductor, then people could listen to what other people were saying. And my favorite line that someone said was, well, hang on, you sound just like me, but you sound completely mad. And coming from each other, it was more powerful than coming from smarty pants therapist who doesn't have an idea, because how could he possibly understand? So the group was a very powerful medium. And what we did in the group was we deconstructed what their notions of gender were. And often they were very, very caricatured and stereotyped. You know, one woman has said that she couldn't possibly be a man because she went into you know, this shop and she wants to buy the blue wash bag rather than the pink one.
Right.
I mean, and they have very definite ideas of men do this, 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 and this. Women do this. Very, very rigid rule system.
This is like early 2000s, is that right? This is
Yeah, yeah,
before social media. Just to
yeah.
contextualize it here, we're talking about you are a clinician, you're working with these people long before this explosion of what's gone on now.
Yeah,
And you're
yeah.
seeing already these are people who have these sort of fixed ideas about gender. Um,
And we started off with two groups. There was a group for post-operative transsexuals who were all regretters, and that was a very depressing group. Nothing could be done. We've ruined our lives. And then there
mm,
was a group for pre-operative ones, which were all gender euphoric. Oh, this is amazing. And so what I did was I combined the two groups, and it was far more interesting and far more powerful because you had people saying, this is what my ideas are, and then they had the regressors going, yeah, well, I sounded like that. You just sounded like how I used to sound like, but and giving them a reality base.
I love that. That sounds like such an extraordinary idea.
Yeah.
I heard you talking about that on Gender A Water Lens, which is a podcast I recommend to everybody with Stella O'Malley and Sasha Ayad. I've been a guest on the podcast too. You were one of my favorite guests on that. But it's just
Charlotte.
struck a light bulb with me that of course people who have undergone sexual reassignment, gender transition, medical transition, and then come to regret it are exactly the people who, before they make that decision, should be meeting and speaking with, because there's the risk that they might end up that way. And that isn't to say that you're trying to tell everybody to never transition beforehand, and you're not telling everybody who has already transitioned that they're going to regret it. You're bringing balance to this discussion.
I choose adults, so people from 18 and upwards. So,
Yeah.
children, it's a very different matter. I'm very concerned about the children's side of thing. But for adults, I don't care what they do. They can do what they want. I'm not meant to be someone stopping campaigning for people to stop doing things. You could go and get a cobweb tattooed onto your face if you want. I think it'd be a pretty silly idea to do, but you can do it if you want.
I think I've seen
my
one or two of those, but yeah.
Yeah, I wouldn't advise it. But so my role wasn't to dissuade people from doing anything, and neither was it to persuade them or help them through it. It was just a inquiring, curious, inquisitive, really? What do you mean you feel like a woman? What is a woman? That sort of, inquiring approach. And because that's what they weren't getting. So most
Mhm.
people, if you asked the man on the street, they would presume that for someone to have a sex change, you would have to go through a degree of rigorous psychological exploration.
Yeah,
Completely false. There is none.
that's
So
right.
at least in the UK, for example, you see a gender clinic, you tell them that you want to transition, they see you 6 months later, they ask you whether you still do, they give the go ahead. There's no exploration as to what on earth do you mean by you think you're a woman or you think you're a man, which is a basic question. And
Yeah.
my regretters all said the same thing. They all said, when we came out and when we had this conclusion that we should have been the other sex, nobody asked us why. They said, we went to our employers and they were being very affirmative and supportive. We went to our families, they're being affirmative and supportive. Everyone was just colluding and going along with them. They said, why didn't anyone just stop me and say, what on earth do you mean? And she said, they're all saying, why couldn't we have someone like you at the time? Because I'd have thought about it. But people just kept going along with them. And
Mhm.
they described a trajectory of gender dysphoria and then this hoped for ideal solution of becoming the opposite sex, which would change their lives in a better way.
Mhm.
Then transgender euphoria, where they were so ecstatic that they'd done it, and then a period of time before the transgender dysphoria set in. And by no means was this all transsexuals. So
Right.
this was a population sample. And my hypothesis is that within transsexuals, I'm saying transsexual, I'll come back to why I'm saying transsexual.
Mhm.
Within transsexuals, there is a degree of autistic thinking. Yeah. So this very black and white, right, wrong, binary way of thinking. And the core deficit in autism is what we call lack of theory of mind. The theory of mind is being unable to perceive what's happening in another person's mind, especially in relation to you. So you may look for gross clues like smiling, frowning, crying, shouting to ascertain what someone else is thinking or feeling.
Mhm.
But you struggle on micro cues and interpersonal social empathy. So what I found was that the greater degree of autism in the person seemed to bode for the better outcome. And the less autistic they were, the worse outcome. And the reason why is that
Mm.
post-op before the sex change, they would often, the gender dysphoria often came from a sense of there's something not quite right. I don't feel authentic as a
Mm-hmm.
man or woman. And then what they do, they transition, and then years later they'd have this sense of, if they weren't very autistic, they'd have this sense of, oh, I'm not really an authentic man or woman, really, am I? And I wonder
Mm.
whether people are seeing me as inauthentic, and that's when the dysphoria set in. But the ones who are really autistic,
Mm-hmm.
they were convinced that, well, I've got long hair, I've got a dress, I've got lipstick, I've got a female name, therefore people will think I'm a woman, and there was no
Right.
doubt about it. So the
Yeah.
autism protected them from wondering, sensing, or fearing whether those around them would not perceive them as a woman, because they're
Mm.
using my pronouns, they must think I'm a woman, which is why they get
Right.
so heavy with pronouns. Because
And they don't
if you
realize
say,
that maybe you're saying, they're using the right pronouns out of courtesy, but they can clearly sense that you're
yeah,
not the sex that you're claiming to be. They can't tell
so
the difference between somebody enacting a courtesy and somebody
yeah,
really, truly, in a deep sense,
yeah.
perceiving you the way you want to be perceived.
And that's why we see so much emphasis on pronouns, because it's, for them, it's not just a word. If you call me he or she, you must really believe that I'm he or she.
Oh, I see. They can't really
So,
sense the
so it's
difference.
not a politeness thing. It's if you get it right, you must believe I am, and if you get it
Mhm.
wrong, then gosh, you must not believe I am, and we must stamp this out, and you must use the correct pronouns, because then you will believe I am. That's the
Yeah.
sort of, that's sort of a simplified summary of the autistic mind on some level, whether conscious or
Yeah. That's really interesting. I've always heard that, especially in this rapid onset cohort that's coming up now, there's a huge number of people who are presenting with symptoms of autism spectrum. Uh, but I always saw this more as like an issue surrounding people's sexuality more than their autism personality spectrum. So I guess it's a combination of both. Um, but I want to talk a little bit about regret. You had regretters in your group, and they're a very interesting number of people. There's a lot of argument that there are very few people who regret, and there's a lot of signs now that that's not true, that there are very many people who have gone unreported who have regretted. But even that word regret, I wonder if there are a lot of people who don't necessarily regret having transitioned, but might have chosen not to had they been given other information. Like, let me give you, there was an interesting study I read. I wish I kept it, but I have to look it up again, about tattoos, about tattoo regret. Something like, if you ask someone a year after they got a tattoo whether if they could go back and do it again, would they? A large percentage within a year would say, no, I probably wouldn't do that. If you ask them by 2 years, even more, and you get to 7 years on, and if you ask someone a tattoo they got 7 years ago, if you could go back and get that tattoo again, would you? It's almost 100%. It's virtually, I don't remember the exact number, it's more than 90%. It's almost 100% of people say, I would not get that tattoo again. But they don't say they regret it. What they say, my friend Bertie Rose, I'm sure you must know Bertie Rose. She's on the internet a lot. She's talked to a lot of gender critical people. She talks about, it's not so, she's got lots of tattoos, and she says, well, I look at my tattoos 7 years on, and I would say that yes, if I could go back in time, I wouldn't have gotten that tattoo. But now that I've got it, I'm resigned with it. It's a piece of my history. It's a part of who I am. It's reflective of that moment in my past. So I have to move on and live with it. And I wonder if there's an element of that with a lot of people who, so if it's not quite necessarily regret, it's something adjacent to that,
Yeah,
like resignation.
it's interesting you say 7 years, because a lot of my patients talked about 7 years. I don't know what
Oh,
it is about 7 years. They one of them
the
said,
7-year itch.
yeah, one of them said that all the people that she had talked to, she had found that it was a 7-year thing. But it's interesting.
Oh,
And
wow.
absolutely, it's the scales of regret, isn't there? There's, well, I could have done things differently, to what have I done?
Yeah.
And I think the one thing that's really important that we don't, which isn't talked about, is, before I was talking about transsexuals, is that
Mhm.
there are very different, distinct groups of people which are now all called trans, and they're
Right.
very different. So you've got people who used to be diagnostically called true transsexuals. Yeah, the people who permanently want to live in the opposite sex, and they're convinced that they should be the opposite sex. Blah blah blah. Yeah, they were the true transsexuals. Then you had a very large proportion of people who are transvestites.
Yeah.
They're crossdressers. They like dressing up. And in my book, where's my book? In my book. In my book, available on Amazon and good bookshops where the staff haven't hidden them in the shelves.
It's called Trans, and what's the subtitle again? Trans.
Exploring gender identity and gender dysphoria, and all the proceeds go to a mental health charity.
Oh, that's fantastic. And this was published in the year 2018, is that right?
2018, yeah. And I've got 2 more books that I want to publish. One called D-Trans and another one, which I won't say the title, is quite good, so I might steal it. But it's finding a publisher who is gutsy and ballsy enough to publish it, because they're far more gender critical. So any publisher out there, just get in touch with me.
I want to go back to that book later, but we're on a great thread.
So you have the group of true transsexuals, you have the group of cross-dressers, and in my book I describe 11 different subtypes of transvestites.
Wow.
And then you have the people for whom it's a sexuality thing. So the autogynephiles, who are men get sexually turned on by the fantasy of having breasts and a vagina, or autoandrophiles, female version, and on the fetish type things. And they're very, very different. They're not the same. But whereas now that we don't talk about transsexuals, we don't talk about transvestites, and some people talk about autogynephiles, but they're all called trans, and they're all societally treated in the same way, but they're not the same. They're completely different. So it's confusing now for people, because they're encouraged to think of them all as the same. Not at all.
That's exactly right. Even gender dysphoria, we shouldn't be calling it the same thing, because that was a term that was really coined.
I forgot a group. Transsexuals, transvestites, the sexuality ones, and RAGD, which I've always said is a youth subculture. It's not even a medical condition.
Why would we use the same words? This youth subculture, that's exactly right. We shouldn't even be calling it a variant of gender dysphoria. We should be using an entirely different term, so that there's no risk of confusion, so that clinicians aren't treating a 3-year-old boy who just gravitates towards girl stuff and is distressed about it because he doesn't understand that he's not like the other boys or the other girls, versus a teenage girl who in any other generation would have been dealing with an eating disorder and struggling with something that would have been treated very differently. I don't understand why we're even using the same language. It just seems to confuse
it's
this
ridiculous.
issue.
I mean, we should just ignore the RAGD and just let them just be whatever they want to be, and let them discover themselves. I had little bag with 27 dolls in it that I had to carry around as a child, much to the embarrassment of my siblings, and my parents just humored me. So he likes dolls, he's got action men as well, but if I had different parents and I was in this day and age, I'd be probably shunted to some gender clinic and be in the middle of being castrated. But luckily my parents were not that bothered about it, and they just said, he's a bit, just let him play with what he wants to play with.
And that's just it. My mother was not that bothered with my feminine toy gravitating towards ing. Bad sentence structure there, but no, it just wasn't a problem. It was just we just left it alone, and then it just resolved itself. It didn't become a hang up, so therefore it didn't become a distress. I didn't sense any distress at the fact that I liked playing with my sister's toys, and so I didn't react with any distress about it, and it didn't turn in. It didn't it didn't seed that thing that seems to develop in some of these kids.
So they all manifest in different ways. So if you look at Twitter, or you look at people protesting, or the people that make the most noise, you get this very skewed, sort of confusing combination of people, and you get these these fetishistic males who want to then suddenly go into a female prison, who's to say they're trying. There's an unhelpful bunching together of the fetishists, the cross-dressers, and the transsexuals, and that's where you get problems in terms of self-ID, because if you're a fetishist and I used to work in a sexual perversion clinic for 12 years, and we treated loads of sexual perversions, and we treated flashers, we treated people who got turned on by frotterism and sexual assault, and and we heard all the tactics that they had, and so if you have self-ID and you can say, well, anyone can say that they're a man or a woman, and of course this is an open door to the fetishistic group. So I'm not talking about the what we call the true transsexual group who want to have a peaceful life living by the seaside, but the fetishistic ones who can say, well, yeah, I'm a woman now, and then make the most of this sort of free pass they've been given, spend all day going to all the women's changing rooms, all the women's toilets. You know,
Yeah. Now you say that term true transsexual. I'm sure you mean that in a clinical sense, as in this
in
is a
the
group of
in
people
the
who have
clinical, I
persistent
don't.
dysphoria. But that's
So,
terminology that can be very rocky because I know
so
people
yeah,
outside of
so
clinic.
what I'm not saying is I think they truly are transsexual. I'm saying that was
Right.
the old-fashioned diagnostic term. So
Yeah.
um, I don't think anyone's born in the wrong body. I don't
Yeah.
think anyone's body is wrong. I think people can come to a conclusion that they are, but then we've got other patients who come to the conclusion that they'd be better off dead. They're suicidal, depressed people. We've got people who think that
It
they
doesn't
should
mean you're
be.
true dead.
No, well, exactly.
Yeah.
You know, we're not yet, you know, euthanizing or depressed people because that's what they really want. And the anorexics want to be, you know, even thinner than is humanly safe, but we don't help them with diet tips. But this is the one thing that we do go along with. And these are people for whom there is nothing wrong with their body. And I'm not talking about people who have you know, what we call intersex conditions, where they're hermaphroditic conditions.
Yeah.
I'm talking about
Hmm.
people who biologically are male or female, and rather than helping them understand and come to terms with why on earth do you find yourself at this place where you have this really firm belief that you should be something else or you are something else, which is of course psychological, we're going along with the fact that their body is wrong. It's not wrong.
Yeah, this is seems to be the only sort of
Mm.
psychological condition, with the rare exception of body integrity identity disorder,
Yeah, body
which is an
integrity and
extremely
dysphoria.
rare
So
phenomenon where people want to amputate their
anoptophilia,
limbs.
yeah, anoptophilia, where you believe you're a partial person in a whole person's body, so you need to have a leg or an arm removed, or that woman who famously believed that she should be blind and got her psychologist to put bleach in her eyes to make her blind.
Oh
Now she's
god,
happily
yeah.
blind.
No, I mean, we don't need
That's
to
not
dwell
true
on
care.
those. Yeah,
Yeah.
those are rare and unusual exceptions. Whereas trans is now it's hugely mainstream. I've just been thinking about why is gender nonconformity being treated like a sickness now? There are all these children's hospitals across Canada. They're literally called hospitals for sick children, and they're just obsessed with talking about helping kids explore their gender journeys and affirming their personalities. And I'm like, if you want to affirm a kid's feelings, write them a poem. You know, hospitals are
Yeah.
not poetry classes. Medicine is for treating sickness. That is literally the definition of medicine. It is for treating illness. It is for helping people resolve their illnesses and to get better. What illness is there when you're starting to just say gender nonconformity, just gender nonconformity, just feeling as though the way you feel about how you yourself map onto the world's sex stereotypes means that you have a sickness that needs to be treated. I find that shocking. And over the last 20 years, this has completely shifted in the practice, wouldn't you say?
Well, it's exploded in the last 5 years, really, especially with kids. And I think there's three things. I say that thinking, I hope I remember what all three are. I think there's three things at play. One is the massive stranglehold that the gender ideologists, Stonewall, all that lot, mermaids,
Mhm.
have on these institutions, and
Yeah.
they've infiltrated in, and they've brainwashed them, captured them at every level, and they've succumbed to this emperor's new clothes ideology, where they've given up with the world being spherical. They believe the world is flat. They believe there's 100 genders, and they've joined the cult. So there's that thing. There's
Yeah.
I've talked about this so many times, so I hope your listeners aren't sick of it. There's the shift in subculture. So an articulate friend of mine who works in the music business very helpfully pointed out that up until the advent of social media, youth subculture, and we've always had youth subculture since the war,
Yeah.
whether you're
Mhm.
a mod, a rocker, a punk, a goth, or whatever, has
Yeah.
always been music based,
Yeah.
and up until social media. And
Yeah.
so when we were kids, your favorite bands and your favorite music was your identity, and you
100%.
obsessed about those, and you were really into the music, and the music became more of a it wasn't just music, it was more of a meaning to your existence, your identity.
Deeply and thoroughly. I was a goth, and I
I
thought I
was
was
a
gonna be
goth.
a goth till the day I die. I was like, I would sit there at
Well,
19 years old
some of
wearing
us
all
still are
black.
in some respects, skulls,
Oh, look at
everyone.
that. You've got some goth left in
So,
you too.
so
Yeah.
I think once a goth, always a goth, even though it's more subtle now. Thankfully, my hair. But But when social media came along, the functionality of music changed. So music just became
Absolutely.
music. So kids aren't really as obsessed with music as we were. They're more obsessed in their social media profiles. And
Yeah.
that is where their identity is. And then you get social influencers coming in. So you've got two things so far. You've got the capture of ideology on organizations, including schools and hospitals. You've got the role of social media and subcultural identity. And, what is the current trendy thing to be as a kid? It's not a goth, it's being non-binary or trans. Non-binary or trans is goth Mark 5. And,
Yeah,
I
absolutely.
did that will be my sort of most famous thing I've probably ever said. I was goth Mark 1, goth Mark 2 was slightly happier. Goth Mark 3 was when they started branching out from just wearing black, and there was sort of like Cocteau Twins, it's more shoegazy and different colored hair and stuff. Goth Mark 4 was emo, and that was post social media.
Yeah.
And Goth Mark 5 is trans and non-binary. They all look the same. If you look at goths 1, 2, 3, 4, and 5, they all look the same. They all look a bit androgynous and sort of funny hair, funny colors, and being a bit miserable, despondent, and being a bit asexual. That's the whole point of being a goth. It's a subversive reaction against the normative framework that you're in, as is all subcultures. But goths, particularly goths and punks, post-punk goths and goths, it's all about not being typically male or female. And that's all that, so I remember when I went to school, Jenny turned up with massive backcombed hair. We were going, oh my God, you're so cool. What are you? She said, I'm a goth. Within 2 weeks, there was an epidemic of goths at my school. We were all goths. We all had
Social
vertical
contagion.
hair,
Yeah.
eyeliner, and
You all look
so
like Robert Smith and Susie Sue, right?
oh, we wanted to. Gosh, yeah. I look at photos now thinking, God, I look more like a Pasadena than a. Anyway, in my head, I was looking like Robert Smith. But if anyone wants tips on how to backcomb hair, I'm an expert. So now, some kid goes to school and they're looking all androgynous and cool, and they go, "What do you got? I'm non-binary, I'm trans." And then the whole school is, and they haven't suddenly got like an epidemic of measles. It's social contagion of a subculture that's they're being cool. But luckily, when we were goths, our parents didn't tell us as a medical condition. We're going to get him to have his lips tattooed black, and permanently backcombed hair, and thankfully. But now these parents who've seen a half-hour documentary are now all clued up, and the schools have been captured by Stonewall. Go, oh yes, you're trapped in the wrong body. Yes, we'll change your pronouns, and we'll then chop your bits off, and
It's
and we're
horrible.
castrating them. So
They're
we see
using
it.
medicine to affirm this thing. They're
Well,
using medicine to affirm
medicine sounds
identities.
medicine sounds curative and treatment. They're using chemical castration agents. Let's not beat
That's
around the
right.
bush.
You're
So,
right. I just mean they're
we
medicalizing. They're going to hospitals and
but
surgeons and
it's not a
endocrinologists.
treatment. It's a these are treatments or chemicals which are used against their license. So they're not licensed for this in children.
Mhm.
They used them on grown-up people in the war, homosexuals like Alan Turing. We all go to the cinema now and go, oh, isn't that terrible that they were chemically castrating gay people? Yeah, they don't think it's terrible when they're chemically castrating the children. And like this friend of mine said, he said, well, at last people are able to castrate their gay children like they've always wanted to do. Because what we do know is that a lot of these gender non-conforming people just grow up to be gay.
That's right.
They'll
It's
grow up
exactly right.
with a normal gender identity, but being gay. So what you're doing really is castrating the gay people.
And it's really
And
scary because some of the language even is kind of explicit. There was a brochure I saw. It was a clinic in Thailand. I thought that
mm,
Thailand had passed legislation that they weren't doing any surgeries on minors anymore, but there was a clinic that was still advertising surgeries for vaginoplasty for underage boys, and they had a picture in their brochure of a child who looked like 10 or something. This was a child who looked prepubescent. And this child is like this little boy's looking in a mirror, and the
oh,
reflection in
I've
the
seen
mirror
that.
is like a
Oh,
little girl.
awful,
And
awful.
then the language for the surgery, they say they call it functional and sufficiently deep surgery. And I'm like, functional and sufficiently deep for intercourse you're talking about. So what you're
Yeah,
saying is you have a boy and he's going to grow up to be a homosexual and be engaging in sex with men when he grows up to be an adult, and you want to make sure that that sex is penis and vagina sex when that person grows up. There's an explicit statement by saying this penis, this surgery we're going to perform on your child is so that when they grow up and they have sex, it's appropriately heterosexual sex, is what it said to me, and it really
And
upset
also
me.
it's a misnomer because you can't actually make a vagina. All you can do is make a cavity and line it with a penis skin. And, this is with my surgical hat on. And, what we do know is if you give people what the sanitized version is puberty blockers, i.e. castration agents,
Yeah,
then they don't go
castration.
through puberty. And if you don't go through puberty, you're left with a pubescent tiny little penis.
And the
then if you want
longer your penis is, the deeper the cavity, so to speak.
exactly. So if you have
Yeah.
this little prepubescent penis and you
Mhm.
invert it, that's not going to be useful for any sort of sex.
Mhm.
And then and the cavity you make isn't a vagina, it's just a cavity lined by penis skin, which then is prone to infections and all sorts of things. And it's not a vagina. You're not actually making boys into girls and girls into boys. You're
Yeah.
rearranging them surgically to look like they could be, but they're
Yeah.
not. And then you get these people saying, I'm biologically male now, I'm biologically female now. You're not.
No.
You're still biologically what you were. Your body looks a bit different. You're reliant on hormones for the rest of your life. That's not the same as biologically.
Yeah, well, there was a surgeon. I was reading an article from, I think it was 1977 in the New York Times, 1977, 78. This was around the time that Renee Richards, that tennis player, had just was playing on the women's team, and there was it was like the early controversy around sex change. This would have been, I think you've mentioned you're a fan of the Velvet Underground and that era of New York where there was a lot of trans going on. That was very interesting and artsy. But anyways, there was a surgeon in Morocco, I think, who was a very famous surgeon who had performed hundreds of MGF surgeries, who said something like, yeah. And his
he said,
quote
I'm
was,
not turning men into women. I'm turning to men into men who look like women. Or
I'm
something.
turning males' genitals into genitals that have a feminine aspect, and the rest is all in their minds.
That was Dr. Bura and Casablanca. Yeah.
That's great. I just thought that was wonderful. And I have a friend who is recently had genital reassignment surgery, had vaginoplasty, who is recovering and is happy, and is an adult who really took a long time to think about this decision, and I support it in this person entirely, who said that they had to sign a form, that they were acknowledging the limitations of this surgery. Essentially, it seems to be saying this isn't a literal change of one's biological sex. It is exactly what that surgeon was saying. You're just rearranging components of the body for a superficial appearance. And I thought that was really interesting. That you have to acknowledge it.
About the regret rates, there are no follow-up studies. So when people quote the regret rates being whatever they're quoting, it's completely whatever word I'm not allowed to say on this. It's nonsense. Let's say it's nonsense.
Yeah.
Because there's no follow-up. So none of my patients who regretted were followed up. They're invisible statistics. So when they say, oh, there's less than 1% regret rate, based on what? If you don't do follow-ups, I asked the gender clinic once, I said, why don't you follow up patients? They said, oh, because we're giving people what they want, we're releasing them into the world like butterflies. Right. Okay. So if you have any sort of dental procedure, there's probably loads of evidence-based medicine studies to show that treatment is but chopping breasts off and creating a vaginoplasty and chopping a penis off. Let's not follow that up. See what that's.
Oh yeah, I think there was one study I saw, and somebody was talking about the regret rates being so low, and somebody was digging through what do you call it, how they organized the study. And one of the lines said something like, we excluded anybody who didn't identify as trans anymore. And I thought, well, that's going to exclude anybody who regrets transitioning. So somehow there were people who still identify as trans who regret transitioning. And that number was way higher than I expected. I would have thought 0. But they just kicked everyone out who no longer identified as trans.
But also there's a determination not to follow them up. So myself and my research team in Australia, because I lived in Australia for a bit, invented a diagnostic tool, which was also an outcome measuring tool. And it measured how stable and satisfied someone was with their gender. And it didn't rely on being male or female. It could be any gender. It was just how happy and stable you are in your gender. Yeah.
Whatever that means to you.
Trans male, trans female, non-binary, whatever. Because all other scales were outdated, stereotypical, sort of, whether you like gingham tablecloths or lumberjacks, or so this was a very contemporary tool, and it was a 14-item self-report questionnaire. And it could be used to measure the outcome of therapy, surgery, hormones, any intervention, because all interventions are aimed at making people happy about their gender and stable. By stable, I mean not changing your mind every week, because that's just sort of inconvenient.
It's a lot of surgeries.
So we spent ages doing this tool. We piloted it through the whole of Australia, and we published the results in the International Journal of Transgenderism. And it's a valid and reliable tool. So we've invented the wheel. I then, in Britain, write to the gender clinics and the Tavistock saying, look, you're being criticised for not doing follow-up and data collection. I've invented the wheel. It's not going to cost you anything. It's a free-to-use tool. It's available online. Would you like to talk to me about using it? They've never replied. I wrote to the medical director, the chief executive of the trust. They never replied. I mean, I'm sorry. If the government says, why aren't you doing data collection? This is the main criticism, do it. And someone says, oh, look, I've invented the wheel for you. It's free. I don't want anything for it. Why would you not? It baffles me. It's totally baffling.
Deliberately trying to cover something up. Just like that study that deliberately excluded anybody who no longer identifies as trans from a study whose whole purpose was to count how many people regret identifying as trans. That's a deliberate attempt to cover up a scandal that they seem to already know is there, but that they are just actively in denial about. So obviously the regret numbers must be higher, and these other feelings that might be adjacent to regret.
26% of my patients were regressive, but there's a very skewed sample because it's people coming to me for therapy. So it's not representative, but 26% of my patients, that's quite a lot. There was a constant dream.
You just think gatekeeping, we talk about gatekeeping, that term, a lot in this world. It's gone now, most of the gatekeeping. But when it was there, it actually gatekept. I talked to Ray Blanchard, and he talked about how when we had gatekeeping, there would be like a 1-year waiting list to just get an appointment.
Or longer. Yeah.
And then he said like 2/3 of my appointments were just blank, so you could just triple book everything. Because within that year, that person, whatever urgent crisis of mind they were going through, would go away on its own. So I was thinking, maybe you should keep that 1-year waiting list then, because that helps people to cool their heels. And that the fact that when there were hurdles to getting transition, that actually led almost everyone to not get transition. That terrifies me. That means any study that has regret rates from back when almost no one went through with transition is going to have massive numbers of regret rates. Now that anyone is being thrown in there.
With what's happening now, there'll be a massive tsunami in 5-10 years of huge numbers of adult eunuchs who are going, what on earth's happened to me? And they'll be, serving people. But we're almost there. We're not quite there. But of course there's going to be, it's obvious. And to dare say otherwise is considered sort of criminal.
Yeah, it's hard to be involved in. I mean, you're involved in this as a career. I'm just involved in this as an activist who wants to help spread the word and change things. But I have a lot of compassion for people who are trans or people who experience gender dysphoria. But I'm also very critical of this whole movement, and that can be a difficult sort of line to tread. But for example, your compassion for people who are going through gender dysphoria really shows in these groups that you were putting together, where people who wanted to transition were being brought into groups and meetings together with people who regretted them, so that they could hear the truth about what this is, and they could really evaluate for themselves whether this was the right decision for them. I personally feel like anybody who understands that they can never literally change their sex, and understands that they feel that medical transition is going to help them feel better about themselves, and they've really thought through the pros and cons of this, should go ahead and do this, as long as they're an adult who's,
And
but they need to know. And young people, I'm seeing young people online saying they can't find that information. Young people who are feeling dysphoric who really are unsure of whether to move forward, but they're mired on Reddit and social media, and they're not getting the information they need. They're not being brought into rooms with regretters so that they can talk to regretters and meet them and see how much they have in common with them, and see if maybe they might see some of themselves in these regretters, and realize that maybe they can work through whatever issue they're going through without taking that same journey. Or others might decide that they should. In your group, how many people went through with surgery.
Well, like I said, the aim wasn't to persuade or dissuade, but
Yeah.
actually less than 2%.
Less than 2%. So that's incredible. These people who come into these groups and are able to freely and openly talk about what sex is, talk about the limitations of what sex changes are, and meet people who have had these procedures, almost all of them don't go through with it. Do you think their dysphoria went away, or do you think they just chose to live
No,
with it?
it did because they saw that this fantasized solution was just that, and it was those underlying things, or the trajectory that got them there was able to be unpicked, and it made sense. And I think the moment that you know that your group patients have done well was when I left the NHS. I went to live and work in Australia for a bit, and I had to leave the clinic and disband the service. And one of the last group, they were so touching. They were so grateful. But one of the last group I had with one of them, so I had a number of groups. They said, "So let's get this straight. So you're going to live in Australia?" I was going, "Yeah." And they said, "Because you think your life will be better?" I was going, "Yeah." They said, "You've never lived in Australia before, have you?" I said, "No." They said, "So you're going to make a big life-changing decision, something you don't know, that you think will make your life better. This is your equivalent of a sex change, isn't it?" And I thought, oh, you're right. And yeah, and I did regret it, and I came back, So.
At least you could come back. You could book a flight,
Exactly. Yeah.
Oh, that's lovely. But I mean, you still work.
Your point about the yes, I'm gender critical, which means I'm critical of the ideology, i.e., the world is flat. There's no such thing as biological sex. You can be whatever gender you want to be. I'm critical of that. That doesn't mean I'm not compassionate about trans people. Why on earth would I spend 22 years studying, researching, publishing, and clinically providing a service for people if I didn't feel some sort of interest and compassion about it? And I think the clinical setting has now changed, because when I was doing this for let's say the first 17 of the 22 years, it wasn't in the news, it wasn't really talked about, it wasn't in social media, and I could get on with doing this quietly, and it was fine, and my patients were all lovely, and none of them had any problem with me. None of the patients I've ever had in therapy have had a problem with me, because they realize I'm a thoughtful, nice human being that wants the best for them. But in recent years, with the whole I've coined the term trans terrorist, and I think that there are some people, and they may be either transsexual or transvestite or autogynephile, I don't know, that they're very, very vocal, very vitriolic, very angry, and out to cancel and ruin anyone's lives who doesn't agree with them. They've sort of taken over, and they are a bit like what ISIS are to Muslims. Yeah. So if you've never come across any transsexuals or whatever it is, and you'd only come across the trans terrorist, you may be led to believe that they're representative and that's what they're like, and all trans people are like that. Whereas I know they're not, because I've seen hundreds, thousands over 22 years, and the trans terrorists are nothing like my patients. My patients were not like that, but that whenever we do conferences or anything, it's the trans terrorists that turn up that want to sort of
And most of these people aren't even trans, of course. They're allies. I think when you see these crowds of people, and I know that there have been crowds organized to protest you, these are probably a small number of people who identify as transgender.
I'm on a kill list. I'm on a kill list. It's like, Kill Bill. Oh, yeah.
Oh, God, that's terrifying.
List. Yeah. Well, you still get used to it, but that's the thing now. So now therapists aren't willing to do that sort of work. I mean, I've made a decision now. I'm going to do very little of it, and I'm just going to concentrate on detransitioners, because otherwise you're just setting yourself up for awfulness. And like my PA was saying, why don't you just treat all your nice ADHD, depressed, anxious, burnout people like you, and OCD? Why even getting into this minefield? I thought, you got a point, actually, because all the time they're trying to cancel you, ruin your lives and everything. So therapists, so you said it's a shame that these confused people can't sit in the room and have this sort of exploratory therapy. it's going to be impossible because therapists now aren't willing to do it. Why would they, when they can treat other people who aren't going to try and ruin their lives?
Yeah,
So
I mean, there's always been a passing of the buck around this. The surgeons didn't want to hear what was going on in the patients' heads. The psychiatrists didn't want to hear the nitty-gritty details of what was happening after they greenlit the surgery. And then there's just always been a passing of the buck around this issue. People seem to be really uncomfortable talking about it and addressing it. And now it's finally reached the mainstream, and there's a lot of people taking interest in it. But now clinicians, they're not passing the buck so much as they're terrified. So they're not, a lot of these patients are not getting the help they need because they're being bullied. You were faced some action from.
all the time. Yeah, I mean, they so on Twitter there's frequently or have you ever been a patient of, and they list the people on their kill list, and they're they're looking for people to give them something, and then you might get, so there was a I won't do
Now
this
you
now,
mean
but
a literal kill list, like people saying they want to kill you? Is that right?
as in ruin and cancel,
Okay.
as in,
Okay.
yeah, ruin and cancel. But no, there's lots of killer turf lists.
Yeah.
Apparently I'm a
Those are
turf,
kill lists.
but like, does that mean I'm not sure what I could be a turf. That means you're a radical feminist. I don't even know what radical feminist. I don't know anyway. But no, we are on various kill lists. But so not only are they not getting that therapy, but what I found was that even the ones who are getting the therapy, the gender clinics are so closed off, they won't communicate with us. So, for example, I might have a patient who I'm seeing for weekly psychotherapy, and I might see them for a number of years, say. So I know them inside out. I've had, in terms of data, I've had lots of data on this patient. Yeah. Then the patient might say, "Oh, I wouldn't mind having a chat with someone about hormones and surgery." So I might refer them to a gender clinic, and then the gender clinic doesn't respond, doesn't say thank you for referring this patient, doesn't have this line of communication with me. So if I refer someone to any other specialty, like an endocrinologist or a cardiologist, there'll be this communication. Thank you for the patient. I saw them. This is what I found. And none of that. So I might see a patient, in depth for over a year. They go to this gender clinic. Day one, they get given hormones. So none of this, real life test of living the opposite role. They get the hormones on day one, and then they see them 6 months later, and then 12 months later, they're booked in for surgery. So I've seen them every week for an hour for over a year. They've seen them twice, and I think, how does this work? And I don't think the person is actually a good candidate, because I don't think actually it'll be right for them because of what I know about them. But they've never asked me. They've never said, what are your thoughts about this patient? And I could have told them that they would regret it. And lo and behold, yes, they do. So it's this closed off little sort of, and it's not like any other branch of medicine. And it's this very small little club that the rest of medicine is excluded from.
It's insane. And I think this is where the politics comes in. I think the progressive values that people want to express that they have has turned everybody into, they think they're being a savior somehow by ignoring all the safeguarding issues. I've never seen anything like this. This is supposed to be medicine, but it just sounds like some crazy cult. It just doesn't sound like medicine. The way that we're dealing with sometimes minors too. Obviously, gender surgery, gender medicine is for adults as well, but especially around the children, puberty blockers. This is extremely experimental, shockingly powerful treatment that these children are being put through. It's totally experimental. It's not being thoroughly tested. Nobody wants to even see if there are any negative results. Everybody just doesn't want to hear anything bad.
But it's the way it's portrayed. So rather than calling it chemical castration, you're calling it puberty blockers, putting a pause in puberty. Rather than saying you're going to amputate the breasts of girls, you're saying it's top surgery. They're these sanitized, and rather than not even exploring why on earth they feel that they're the wrong sex, you're calling it affirmation therapy. Affirmation sounds positive, doesn't it? Affirming sounds great. But affirming means you're not asking them, oh, why do you not like being a boy? Why do you not like being a girl? Which is the obvious question.
Yeah.
You're,
And now
you're
they're trying
just
to
saying,
ban it.
oh yes, affirmative therapy is yes, because your body's wrong. Well, this is what we can do. So affirmative is collusion, whereas exploration is always helpful. With any problem, think about it and explore it. But for this problem, you're not allowed to explore it because then you're transphobic. And that's what the sort of the gender mafia, the gender ideological mafia have convinced everyone. If you try and think about it or explore it, you're phobic and you're intolerant. Or what you should do is affirm it, collude with it, and people go along with that because affirming sounds good. Top surgery sounds sanitized, and puberty blockers. Oh, you're helping them have a relief and a pause from puberty. No, you're castrating them. You're amputating their breasts, and you're not even asking them why.
Collusion is the perfect word. It's so difficult to talk about that issue, especially here in Canada, because we have passed a law, one of these conversion therapy bans, where they hijack the wording of conversion therapy around
Yeah.
sexual orientation to frame anything that isn't affirmative, isn't colluding with the patient as cruel mistreatment. But that's exactly the right word, collusion, because these people are living in a kind of, as Kathleen Stock, the philosopher, has said, it's sort of like a live action role playing. They're living in a they're playing a role, and you're colluding in their role play
Well,
when
it's
you
it's
help them
it's
with thought.
appropriation. If we look at other people who are appropriating other aspects of life, we call it out. So, I often compare it to people who have problems with other variables. So, we are a constellation of variables. We are our height, weight, ethnicity, race, culture, sex. So, if you have a problem with your, anorexics, that's what the weight thing. So, I talk about the transracial people. So the famous ones that are open about it are Rachel Dolezal and who's the trans Korean guy, Ollie London. Don't know whether you've seen him
Oh
on
yeah,
Twitter.
yeah, yeah.
Trans
Right, I
Korean.
forgot about that one. Yeah.
And I say, look, this is a person who believes and identifies as being Korean. He's never been there. He wasn't born there. He was born as Adam in Kent, but he's physically, surgically made himself look like the variable that he identifies with. But the trans people don't get it. They but it's the same. It's a variable that he's not happy with. He's identified something else and changed himself physically. And so we're very quick to call out misappropriation of race, but we don't call out misappropriation of gender, because all these people can do is impersonate. They've never been a man or a woman if they're a man, or a man if they're a woman. They've never been that. All they can do is impersonate, and it's perfecting the impersonation, which is by definition appropriation. And that's why lots of women get upset, because they feel, hang on, this is like some cuckoo in the nest scenario. This is, you're not really, and it's, and for some who aren't transsexual but are transvestite, the appropriation is a bit like the equivalent of, say, blackface, where you're temporarily putting on another sort of aspect of another thing, which we're very quick to call out and say, well, we don't like that. So coming from either the transsexual or the transvestite or the fetishist route, there are different meanings for the appropriation and why they're doing it, but we're considering them all the same. But that's basically what it is. They're not, and we should get away from this idea that people are born in the wrong body, they have different brains. They don't. Everyone's bodies are right and their brains are all fine.
Yeah, we see that we live in a world where there are stereotypes associated with men and women, and we see that we have personalities that might have elements that are more masculine and elements that are more feminine, and how we decide to map ourselves onto that.
Well,
people seem to treat that like it's sacred and innate and inborn, and it's not. These are all a bunch of shifting variables.
I mean, masculine and feminine, they're made up terms by society, So, Judith Butler gets a lot of stick because she's her queer theory. But one of the things that she very described really well in Gender Trouble was the social constructs of masculine and feminine, and the performative nature. When you have a society which deems certain things to be feminine or masculine, and then people do it because that's what they're told is masculine and feminine, and by repetition it becomes ingrained and it becomes almost like a law. Like in our society, it might be feminine to have long hair, lipstick and high heels, but in another country, a society in Africa, it might be feminine to have a massive tongue plate under your tongue, or massive rings around your neck in metal rings, or a shaved head. So it's completely society dependent. So they're made up. There's no such thing as gender. We societally make it up. And if you're gender confident, you can be subversive and say, well, not you, I can be whatever I want to be. And if your framework is wrong, then your framework's wrong. But if you're gender underconfident, you go, oh, I don't fit in with these rules, I must be wrong. And we should be helping people to understand that nobody's wrong. You're not wrong. The framework is this social framework. Start the framework, which the whole point of being a punk and a goth is to punk something, is to abandon the framework. So when David Beckham wore a sarong and a diamante earring, he at the time, that was sort of outrageous, but he was being confidently subversive. And I tried to get my patients to be more subversive because they're so adherent slavishly to this framework. I'm saying, just forget the framework. If you want to have pink or this, that, and the other, do it. It's rubbish, because pink up until 1920 was a boy's color. It was only in 1920 they decided it was going to be a girl's color. It was a classic male public school color.
A very masculine color until then, yeah.
Totally. And so, forget this framework. It's meaningless. The whole gender thing's meaningless. So don't get, caught up in it, bound up. Don't let it ruin your life. Just get on with your life as you want to do, and then forget about the gender stuff. The role of social media is massively important. So just to give you an example, when I see young 17-year-old girls, biological girls, who are attracted to other girls, and I say, so you're lesbians? No, because I'm a trans man. Again, well, you haven't had any sort of procedures or anything. You're not. They said, no, because I'm not. I fancy women. And I said, do you know any lesbians? And they said, no. I said, can you think of any famous lesbians? They said, no. Which trans men do you know? And they reel off all these social media influencers. And I've said for a long time now that lesbians got a very bad PR issue, in that it's like, in this day and age, these young girls going, well, why don't we be a lesbian? What's that? What's a lesbian? Whereas these trans men, like these sort of muscly, hairy, I'd rather do that. So lesbians are sort of obsolete now for teenagers, and the trans man is the new Mark II lesbian, I think, from what I can gather.
Yeah, it seems to be that way, and I hope that can change. I really want to see lesbians, bring out some great role models for kids. I've been arguing that for at least 2 years now. I think that's very true. I think young gay men too need some role models. We're starting to see so much more distress around gay men's sexuality.
Although in the last 20 years, it's always been a bit more cool to be a gay man than it has been to be a lesbian in terms of role models and people out there,
Yeah, in fact, there's a little bit of appropriation around that word queer, where everybody is identifying as queer because they think that makes them part of the gay and lesbian community or adjacent to it.
Especially the heterosexual people who are gender conforming, who have relationships with the opposite sex, who look completely normal, who are identifying as queer. Queer in what way?
Yeah, that's insulting. And then there's all these girls with dysphoria or rapid onset gender dysphoria. These girls caught up in this social contagion who are identifying as gay men and are getting really aggressive. I'm seeing more and more of them on the gay dating apps every day. And I'm just wondering what you're doing here. You're not gay in. What are you doing? You're not fooling us. And you're not gonna.
And the very organizations that were supporting the rights for same-sex attracted people are now, bashing them on the head. So now their campaigns are, if you don't fancy someone who identifies as the gender of the sex you're attracted to and has the wrong genitals, then you're phobic and you should get over your genital bigotry, which is a bit like saying to lesbians in the olden days, oh, you just haven't had, a man's appendage.
Haven't had the right dick. Yeah, exactly.
Yeah, exactly. Yeah. That's why you're a lesbian. It's gone full circle. So the very organizations that were meant to be looking after us have abandoned us ever since they got the gay marriage through, and they're now all pro-trans ideology without having the decency of telling anyone that they've changed their manifesto.
And not just changed it, they've completely turned against us. I am the co-founder of LGBT Alliance Canada, and we are trying so hard to get the word out to Canadians and to the Canadian press and Canadian politicians that this is happening. And I think so many people are just they don't even realize how insane it is,
But also
because it
the
sounds crazy to say
organisation.
that organizations that were originally founded for gay and lesbian rights have expanded to the point where they have turned around and turned against homosexuals, same-sex attracted people, because we don't believe that we
And they
should
try and
suppress our homosexuality to accommodate people's gender identity declarations, you know?
and also they want to stamp out the LGBT alliance, which is which is, you know, they want to kill off the very sort of charities that are set up to support same-sex attracted people, which is what they started off in the first place. But it's not
Yeah, I
good.
mean, they might as well just take the LG and B out of their names. It started with LGE and then LGB and then T and IQ plus. Eventually, they're just gonna abandon the LG and B altogether because they won't believe those things exist anymore. There's already been this shunning of the word
And
homosexual.
I'd quite welcome them to ban it, because I think that they've got nothing in common, because sexualities and gender identity have absolutely nothing in common. Why just tag on? Why you might as well tag on Muslims or Catholics or other minority groups that have nothing in common. You know, just because you're a
It's
minority
completely
group.
thing.
Yeah,
Yeah, it's like apples and roller coasters. It's not even remotely the same category of thing.
yeah.
Now, people understand that for a long time, cross-dressing was associated with gay men, and a lot of feminine homosexuals and butch lesbians developed gender dysphoria and became trans. So there was a sense among the gay community that we wanted to support homosexual transsexuals, to use the Blanchard typology. That's blossomed into everything: transvestites, autogynephilic cross-dressers, the whole smorgasbord of people who, that wasn't what we intended
And
when we were.
people can't seem to tell the difference between transsexuals, transvestites, and drag queens. I asked my medical students this. I said, "What's the difference between a transsexual, a transvestite, and a drag queen?" They can never get the answer right because it's a bit advanced. But people don't seem to know the difference. And then, you know, and what I say to them, it's the relationship to the framework of gender. So whereas the transsexual wants to permanently buy into that, the transvestite wants to dip in or out, and they get something out of this escape from reality into this temporary residing into this vestiges of the other sex. And both the transsexual and the transvestite are slavishly adherent to this gender framework. They want to follow the rules. Whereas the drag queen is different. I don't have anything against drag. Drag is the relationship drag has to the gender framework is, look, you think your gender framework makes sense. I'm showing you how ridiculous your framework makes sense, because I'm following all your rules. I've got big hair. I've got makeup. I've got a dress. Do you think this looks feminine? So it's an up yours to the gender framework. So they're
Totally, it's
not
very punk. It's very
slavishly
subversive.
adhering. Exactly. So they're not adhering to it slavishly like the transsexual, the transvestite. They are showing society how ridiculous the whole notion of gender is by saying, look, you think that your gender framework makes sense. I'm showing you how ridiculous it is. So it's not, so I would argue that it's not an attack against women. It's an attack against the framework of gender, because it's a parody of the framework. In the same way that drag kings aren't an attack against men, they're an attack against the ridiculous framework of gender. And I think that people sometimes get it wrong, because they think, oh, well, they're taking the mickey out of women. I would argue they're not. They're showing how ridiculous the concept of gender is. The drag queen isn't trying to be a woman. The drag queen is purposely trying not to be a woman, unlike the transsexual and the transvestite.
Yeah, and yet transsexuals and transvestites care deeply about maintaining gender stereotypes because they need them to feel that that escape from whatever it is that they want to escape from.
Well,
So they
it's
hold on
legitimate.
to them, which is so funny that they all were. Judith Butler's gender trouble seems to have been kind of trying to play both sides at the same time. That drag is all of this gender subversion, but then on the other hand, we have to keep these gender roles rigid as possible so that these people can use them as tools to help themselves feel.
Well, I the thing is, it's probably quite controversial, but I quite liked Gender Trouble because I thought she made sense there, because she talked about the performative nature of gender as a social construct that didn't really exist. She then talked, and the whole thing about drag being an up yours turn subversive thing. But the problem with Judith Butler, I mean, you see, there's a lot of Judith Butler on my bookshelf. I did an MSc in the sort of best way to sort of scramble your head. The thing about Judith Butler is every time she writes a book, she changes her mind. So after Gender Trouble, she then wrote Bodies That Matter, which completely turned on its head everything that she wrote in Gender Trouble. And I'm thinking, oh my God, she had some sort of breakdown or something. She's now not making any sense at all. I thought Gender Trouble was okay because she was sort of saying that gender doesn't exist, and she was saying the whole thing about drag, which I agree with. She wasn't saying gender was this concrete thing and she wasn't really, that was completely quite gender critical, I thought, gender trouble. But when she went to Bodies That Matter and then everything else afterwards, she'd lost the plot and it was just nonsense. So, I'm two minds about that.
Yeah, she seems to have been about two minds about herself half the time. I think some of the time she wrote Gender Trouble, and I would say that, in my opinion, is mostly the same as yours, except that I haven't read nearly as much Judith Butler. And my sense is that she made it sound gender critical, but she pulled her punches, and she always left enough wording ambiguity and confusion there so that you could use it to justify either side. And I think maybe she kind of tilted more towards the
I think
the other way.
I mean, queer theory is all about trying to subvert normative frameworks. I think she was queering her own frameworks after every book she wrote.
She just started. It was like inceptioning herself. She's just
let's queer it. She was coming from. She'd queer it, and then you go, oh god, she's done it again. She's put it in the food mixer.
Well, if you keep reversing yourself, you just end up back where you started. But anyways, we should wrap it up because it's been a good hour. What's in the future for you? You no longer work with groups. You're in a private practice now, and it sounds like you're going to be focusing mostly on detransitioners moving forward.
So I'm going to be focusing mainly on other patients which don't try and cancel and ruin your life. But the work I do in this area will either be detransitioners, or I do lots of consultations to parents or organizations like schools, prisons, stuff like that. So I like to be helpful to the society around the trans person, because that's often very helpful, to help them how to think about it. Often people don't know how to think about it. And I want to continue to write. So yes, publishers, please get in touch if you're willing and brave enough to publish a couple of gender critical books, which will be brilliant.
Oh, I just said before we go, we should talk a little bit about the book that you already have, Trans, from 2018. Yes, beautiful cover, by the way, great cover art. How do you feel about, the things are just moving and accelerating so quickly? Looking back, even just a couple years later, looking back, is there anything you would change about the book? Or
the book was very diplomatic, and I think it had to be diplomatic to get it published. I think what I want to do now is be clearly gender critical, because that's what we need. I think we've come to the situation where we need a definitive gender critical book by a clinical expert, and I think that's the aim.
Yeah, I think that's a great point. I think we're all getting a little bit more harder line as we realize that we can, and as we realize that as the stakes grow and as we start seeing what's going on. I was trying to humor more people's pronouns than I would today, just a couple years ago. I still am happy to accommodate some people's pronouns, for example, under some circumstances. But as this movement shifts, as things change, I'm adapting with it, just like we all are. And it's difficult terrain. All sides can get very heated online about this. Social media accelerates differences and not, it's not very good at unifying people. But it seems like those of us who are gender critical are really developing the upper hand. We're really gaining the upper hand. The wind is at our backs. We're seeing real change starting to happen. I wish it would happen faster. I know in
Have
Canada,
you found that whenever you have a conversation with someone who's not really thinking about this area, they realize that you're just being sensible, and often they say, "Oh, I didn't realize you're allowed to think like that," and what you're saying makes complete sense. And it's almost
the
like
era of no debate is over. Because all they could do was tell everyone to not listen to us, because they knew the second we get a platform, everyone's going to go, "Oh, you're not the devil. You're just a totally normal person."
Yeah, and that's why there's no debate, because the only debate they've got is trans women and women. There's nothing else they can say. Then there's no debate. There are no critiques, or there's nothing. They can't have any sort of discussion, because there is no discussion. Everything we say is actually quite normal and common sense.
Yeah, it's just a lot of emotional anger and rhetoric, and not even a lot of internal consistency. So I'll be glad to see this. I'll be glad to see this turn around. I'll be glad to see less young people and less people in distress of any age get roped into this. I hope you do come out with a solidly more aggressively gender critical book to help clinicians do the right thing, because we really need to see so many more clinicians helping these patients. I care deeply about the best of you. What's that?
That's your task, to find me a publisher.
Maybe I will. But I'm gonna press stop there. But you and I, let's chat for a second. So like and subscribe, everybody. I'm gonna put a link in the bio to your book and anything else you want me to put in there. And yeah, that's it for now.